name is Steve Hofford, and I'm owner and pharmacist of Magnolia Pharmacy. Want to thank you all for joining tonight to talk about methylene blue. I am not here to treat, diagnose, or cure any disease. The information tonight is strictly for your educational purposes, and if you do have questions about your health conditions and whether or not methylene blue would be good for you, highly recommend you talk to your healthcare practitioner about that. So talking about methylene blue, obviously got a big, nice blue background as far as that goes. Methylene blue actually was originally developed as a dye for blue jeans. It's one of those type things, as with many drugs, we start out with one thing and find out it does something else. Believe it or not, it was the first synthetic drug that was actually approved in the United States back in 1876. Couple of tidbits as a pharmacist that I found very interesting was it was used early as a placebo in a lot of drug trials, so that when they gave patients the methylene blue, they knew if they were taking it because it would discolor the urine to a blue color, and they would find out if they weren't taking it because it wouldn't discolor urine. Found that very interesting. Methylene blue, though, actually was first used in a lot of our military troops to treat malaria. Methylene blue, if you look at it as a derivative, it ends up being very chemically structured to many of our first malaria drugs, but it itself was actually used to treat malaria back in the late 1800s. Believe it or not, to this day, methylene blue is pretty much carried at every hospital. It's used for overdoses and poisonings of cyanide, carbon monoxide, and things like that. So every hospital is actually required to keep methylene blue in stock. Also, too, kind of as a side effect, when methylene blue is produced, it actually led into some of our first antipsychotic medications, some of the early antipsychotic medications for like schizophrenia, and some of our earlier nausea medications like chlorpromazine and promethazine were actually early derivatives of methylene blue. So found that kind of interesting in terms of the functions in terms of methylene blue and what it can do as far as that goes. The next big thing that I think is important to keep in mind with methylene blue is that it actually led to the development of other drugs. So keep that in mind, as even though it was an old drug, it actually led to many other drugs moving forward. So early uses of it actually was an antimicrobial activity, that it was used as a therapeutic dye. It was used for staining of cells. A lot of times, what's kind of unique about methylene blue, it typically goes to the part of the cell that's the most productive. We'll talk about that in a second. So it's great to use as a stain for type of cells. It also, as a dye, can show certain type of differentiation in cells and being able to look at those. It also, too, is used for some cancer chemotherapeutic uses. And it also has psychoactive uses for dementia and psychosis. Other clinical uses, and probably the big thing that actually methylene blue is approved for, is actually the therapy for methemoglobinemia. It's a condition where the red blood cells do not carry oxygen the way they should, and methylene blue can solve that problem. It's also used for septic shock. It's used for encephalopathies, ischemia, where poor blood flow is involved, and we're going to talk a lot about that because that's really how methylene blue works. Used for malaria, it's actually making a comeback. Some of our malaria drugs have lost some of their potency, and it's been actually added back in some of the malaria regimens. Also for surgical stainings, I know if there's certain bladder procedures and certain that are done in hospitals, then methylene blue is used for a dye. Now, one of the things to keep in mind about methylene blue, actually it was part of an old urinary antiseptic that we actually, when I first became a pharmacist, it was kind of a product that was used for bladder urinary antiseptic for chronic urinary infections or chronic spasms of the bladder. Can't even talk. So those are just some of the clinical uses of methylene blue outside of what we will discuss in tonight's presentation.